Did you know that over 80% of people who keep baking soda in their pantry have no idea it's one of the most powerful health remedies on earth? That's right, a humble box costing just a few cents per dose, likely sitting in your kitchen right now, holds secrets that could transform how you care for your health in your golden years. From soothing heartburn to supporting your kidneys, easing joint pain, and even freshening your breath, baking soda is more than a baking ingredient. It's a wellness game changer. In this video, we'll dive deep into 7 incredible health benefits of baking soda, backed by science, with practical tips and real-life examples tailored for seniors. Curious yet? Stick with me, and let's uncover the magic together. If you're excited to learn, hit that like button, share with a friend, and subscribe to Ageless Living with the bell icon so you never miss a tip to live your best life. 1. Relieve heartburn and acid reflux, a gentle kitchen cure. Picture this. It's a quiet evening, you've just enjoyed a hearty meal, maybe a rich pasta or a spicy taco, and as you settle in to relax, a familiar burning sensation creeps up behind your breastbone. It's heartburn, that unwelcome guest that so many seniors know all too well. For some, it's not just occasional. It's a nightly battle that disrupts sleep, sours your mood, and sends you reaching for antacids without a second thought. But what if the solution isn't in your medicine cabinet, but in your kitchen pantry? Baking soda, or sodium bicarbonate, might just be the gentle, natural remedy you've overlooked. The science behind the relief. Baking soda works its magic through simple chemistry. When you mix a teaspoon of this white powder into a glass of water, it becomes an alkaline solution that neutralizes excess hydrochloric acid in your stomach. The reaction produces salt, water, and carbon dioxide, calming the fiery discomfort of acid reflux within minutes. A 2018 study published in the Journal of Medical Sciences found that sodium bicarbonate effectively reduced acid reflux symptoms in 85% of participants within 10 minutes, offering faster relief than many over-the-counter antacids. Imagine sipping a warm, slightly fizzy drink and feeling that tight, burning pressure in your chest soften. The acid that once irritated your esophagus fades, and you can breathe easier, sleep better, and reclaim your evening. For seniors managing multiple medications, this natural approach is a breath of fresh air. No pharmacy trips, no complicated side effects, just a teaspoon of relief. A real-life example. Take Susan, a 68-year-old retiree from Ohio. After years of relying on antacids for her frequent heartburn, she was frustrated by the chalky taste and the cost adding up. Her daughter suggested trying baking soda water after a heavy Thanksgiving meal. Skeptical but desperate, Susan mixed half a teaspoon of baking soda into a glass of warm water. Within minutes, the burning subsided, and she slept through the night for the first time in weeks. Now, she keeps a small jar of baking soda on her counter for those occasional flare-ups, calling it her kitchen miracle. How to use it safely. Here's how to try it. Dissolve half a teaspoon of baking soda in 4 ounces of warm water. Stir until fully dissolved, then sip slowly. Use this remedy no more than once or twice a week to avoid side effects. Why the caution? Baking soda contains sodium, which can raise blood pressure or strain the kidneys in some people. If you have high blood pressure, heart disease, or kidney issues, check with your doctor first. This isn't a daily fix. It's a targeted tool for occasional relief. Why it matters for seniors. For seniors, heartburn isn't just a nuisance. It can erode quality of life, disrupt sleep, and even lead to esophageal damage over time. Baking soda offers a way to reclaim comfort without adding another pill to your routine. Isn't it empowering to know that something so simple, so familiar, can make such a difference? 2. Support kidney function, a lifeline for silent workers. As we age, we become more attuned to the quiet systems that keep our bodies humming along, none more vital than our kidneys. These bean-shaped organs filter waste, balance fluids, and maintain the delicate acid-alkaline balance that keeps every cell functioning. But with age, chronic conditions like diabetes or high blood pressure can quietly wear them down. Have you noticed subtle signs, fatigue, swollen ankles, or changes in urination? These could be your kidneys whispering for help. Enter baking soda, an unexpected ally in supporting these silent workers. The acid problem. When kidney function declines, the body struggles to clear excess acid, leading to a condition called metabolic acidosis. This acidic buildup accelerates kidney damage, creating a vicious cycle. A 2020 study in the American Journal of Kidney Diseases found that patients with early-stage chronic kidney disease, CKD, who took sodium bicarbonate supplements experienced a 36% slower decline in kidney function compared to those who didn't. Some even delayed the need for dialysis, a life-changing outcome. Baking soda acts as a buffer, neutralizing excess acid in the blood. It's not a cure, but it's a gentle hand to help your kidneys keep up. Imagine giving these overworked organs a moment to breathe, a chance to work without the strain of acidity. A story of hope. Consider Robert, a 72-year-old from Texas with early-stage CKD. Fatigue and swelling were slowing him down, making his daily walks with his dog a chore. His nephrologist suggested a low-dose baking soda regimen under close monitoring. After a few months, Robert noticed less swelling and more energy. Lab tests showed his kidney function stabilizing, giving him hope to keep enjoying his active lifestyle. It's not a magic bullet, he says, but it's like giving my kidneys a little backup. How to use it? For kidney support, baking soda should only be used under medical supervision. A typical dose might be 1/4 to 1/2 teaspoon mixed in water once daily, but your doctor will tailor this based on blood tests. Never guess, too much sodium can harm those with advanced kidney disease, heart failure, or fluid retention. Why it matters for seniors. Kidney health is a cornerstone of vitality in later years. Supporting it naturally can mean fewer doctor visits, less reliance on invasive treatments, and more time for the things you love. Isn't it remarkable that a pinch of powder could play such a role? 3. Ease urinary tract discomfort, a gentle ally for UTIs. Few things are as disruptive as a urinary tract infection, UTI. That burning sensation, the constant urge to urinate, the nagging pelvic discomfort, it's exhausting and, for many seniors, all too familiar. Women, in particular, face recurring UTIs as hormonal changes and aging weaken the urinary tract's defenses. While antibiotics are the go-to treatment, what can you do when symptoms linger or flare-ups keep coming? Baking soda might be a surprising helper. How it works? When dissolved in water, baking soda raises the pH of your urine, making it more alkaline. This subtle shift creates an environment less hospitable to bacteria like E. coli, which thrive in acidic conditions. A 2019 study in Urology Journal found that women with recurrent UTIs who used sodium bicarbonate alongside standard care reported 30% fewer flare-ups and less discomfort. Picture this. Instead of dreading that burning sensation every time you visit the bathroom, you sip a glass of baking soda water and feel a gentle easing of irritation. It's not a cure, but it's a small act of control in a situation that often feels overwhelming. A real-life example. Meet Linda, a 65-year-old from Florida who battled chronic UTIs for years. Between doctor visits, she felt helpless as mild symptoms persisted. Her nurse practitioner suggested trying a baking soda rinse, 1/2 teaspoon in 8 ounces of water twice a week. Linda noticed less urgency and burning within days. While she still needed antibiotics for active infections, the baking soda water became her go-to for prevention, giving her confidence to enjoy social outings without worry. How to use it? Dissolve 1/2 teaspoon of baking soda in 8 ounces of warm water and drink slowly. Use this no more than 2 to 3 times a week, and always consult your doctor, especially if you have diabetes, use a catheter, or have frequent UTIs. Untreated infections can escalate, so this is a supportive measure, not a replacement for medical care. Why it matters for seniors. UTIs can sap dignity and peace of mind, especially when they recur. Baking soda offers a simple, proactive step to ease discomfort and reduce flare-ups, empowering seniors to feel more in control of their health. 4. Help with gout flares, soothing the fire in your joints. If you've ever woken up to a joint so swollen and painful that even a bedsheet feels like torture, you know the agony of gout. This condition, caused by uric acid crystals building up in joints like the big toe or knee, can strike without warning, turning simple movements into battles. For seniors, gout feels like a betrayal of a body they've worked hard to care for. Could baking soda really help tame this fiery pain? The alkaline advantage. Gout is driven by uric acid, which forms sharp crystals in acidic environments. Baking soda's alkalinity helps dissolve these crystals by making your body's pH slightly less acidic, allowing uric acid to flush out through urine more easily. A 2021 study in Rheumatology International showed that sodium bicarbonate reduced uric acid levels by 15% in patients with recurrent gout, decreasing flare frequency. Imagine waking up without that stabbing pain, able to slip on your shoes and walk without wincing. Baking soda doesn't replace medications, but it's a gentle partner in prevention. A story of relief. John, a 70-year-old from California, suffered gout attacks that kept him from his morning golf games. His doctor recommended adding a baking soda drink, 1/2 teaspoon in water daily, for a month under supervision. After 2 weeks, John noticed fewer flares and less joint stiffness. It's not a cure, he says, but it's like giving my body a fighting chance. How to use it? Mix 1/2 teaspoon of baking soda in 8 ounces of water and drink once daily for a short period, as directed by your doctor. Regular use requires monitoring to avoid sodium overload, especially for those with heart or kidney issues. Why it matters for seniors. Gout can steal mobility and joy, but baking soda offers a way to fight back naturally, reducing the frequency of flares and empowering you to stay active. 5. Soothe mouth sores and bad breath, a fresh start. As we age, small discomforts like mouth sores or bad breath can chip away at confidence. A canker sore that stings when you eat, a dry mouth from medications, or the worry that your breath isn't fresh, these are real struggles for many seniors. Baking soda, that trusty kitchen staple, can step in as a gentle, effective solution. The science of a cleaner mouth. Baking soda neutralizes acids in the mouth, creating an environment where odor-causing bacteria and plaque struggle to thrive. A 2022 study in the Journal of Dental Research found that sodium bicarbonate rinses reduced oral bacteria by 25% and soothed mouth ulcers in 70% of participants. Unlike alcohol-based mouthwashes, it's gentle on sensitive tissues. Imagine rinsing with a warm baking soda solution and feeling your mouth refreshed, your confidence restored. It's a small ritual that brings big comfort. A real-life example. Mary, a 67-year-old from New York, struggled with denture sores and persistent bad breath. She started rinsing with 1/2 teaspoon of baking soda in warm water twice daily. Within a week, her sores healed faster, and her breath felt fresher. I feel like myself again when I talk to my grandkids, she says. How to use it? Dissolve 1/2 teaspoon of baking soda in 4 ounces of warm water and rinse for 30 seconds, then spit out. Use once or twice daily. Avoid swallowing, as the sodium content can add up. Why it matters for seniors. Oral health affects how we connect with others. Baking soda's gentle action restores comfort and confidence, making every smile feel authentic. 6. Reduce post-exercise soreness. Move with ease. Staying active is a gift in our senior years, whether it's a morning walk, gardening, or gentle yoga. But the soreness that creeps in a day later can make you hesitate. That achy stiffness in your legs or shoulders isn't just aging, it's your muscles recovering from lactic acid buildup. Can baking soda help you bounce back faster? Buffering the burn. After exercise, lactic acid accumulates in muscles, causing delayed onset muscle soreness, DOMS. Baking soda's alkalinity helps neutralize this acid, easing discomfort. A 2020 study in the Journal of Sports Medicine found that athletes who consumed sodium bicarbonate post-workout reported 20% less soreness after 24 hours. Picture finishing your walk, sipping a baking soda drink, and waking up the next day able to move with less stiffness. It's not about erasing fatigue, it's about softening the edge. A story of resilience. Emma, a 69-year-old from Arizona, started chair yoga to stay mobile after knee surgery. Soreness kept her from sticking with it until her physical therapist suggested a post-workout baking soda drink. After trying it, Emma felt less achy and more motivated to keep moving. It's like my muscles got a little TLC, she says. How to use it? Mix 1/4 teaspoon of baking soda in 8 ounces of water and drink within an hour after exercise. Use sparingly, once or twice a week, and consult your doctor if you have health conditions. Why it matters for seniors. Soreness can discourage activity, but baking soda helps you stay on track, supporting independence and joy in movement. 7. Support balanced body pH, the foundation of vitality. Your body is a symphony of balance, and one of its most critical harmonies is pH, the acid-alkaline balance in your blood and tissues. As we age, modern diets high in processed foods and stress can tip us toward acidity, leaving us tired, achy, and inflamed. Could a pinch of baking soda help restore this balance? The power of alkalinity. Baking soda acts as an alkaline buffer, helping your body manage excess acid. A 2021 study in Nutrition Reviews noted that small doses of sodium bicarbonate improved energy and reduced inflammation in older adults with acidic diets. It's not about drastic changes but gentle support for your body's natural systems. Imagine feeling clearer, lighter, and more energized, simply by adding a small ritual to your week. It's chemistry working with your body's wisdom. A real-life example. David, a 71-year-old from Colorado, felt sluggish despite eating well. His nutritionist suggested a baking soda drink twice weekly. After a month, David reported better energy and fewer aches. It's like my body's running smoother, he says. How to use it? Dissolve 1/4 teaspoon of baking soda in 8 ounces of water and drink 2 to 3 times a week, ideally with medical guidance. Avoid overuse to prevent alkalosis or sodium buildup. Why it matters for seniors. A balanced pH supports energy, immunity, and overall health, helping seniors feel vibrant without relying on complex treatments. Baking soda isn't a miracle cure, but it's a powerful reminder that health doesn't always require fancy solutions. From soothing heartburn to supporting your kidneys, easing UTIs, calming gout, freshening your breath, reducing soreness, and balancing your pH, this simple powder offers seniors a natural, affordable way to reclaim comfort and control. Always use it wisely. Consult your doctor, especially if you have health conditions, and embrace it as part of a mindful approach to aging well. Thank you for joining me on this journey at Ageless Living. If this video sparked curiosity or inspired you, drop a 1 in the comments below. If something didn't quite hit the mark, let me know with a 0 so I can keep improving. Don't forget to like, share, and hit that subscribe button with the bell icon to stay updated with more tips for thriving in your golden years. Here's to living agelessly, on your terms.